Move ahead with Laura and Angie, who is going to talk about head bleed antidotes on antithrombotics, an algorithm high-level approach for neurointensivists. Thank you.
All right, so I don't have any disclosures. Some of the objectives, we're going to go over just warfarin, dabigatran, and direct factor 10A inhibitors and what the current treatments are for reversing these agents. But I just have this chart here, and we're just going to go, these are just some of the reversal agents that are available. And then if you look here at dabigatran, direct 10A inhibitors, and warfarin, you can see which ones are available for each agent. And we're going to refer back to this table a couple of times throughout the presentation. Right now, we're going to start off by looking at warfarin. And as you can see down here, we have the 3 and 4 factor PCCs that are useful in reversal, as well as the activated 4 factor PCC, and obviously FFP as well. So here we have just a picture of the clotting cascade, just to remind ourselves where some of these drugs are acting. And when we're looking at warfarin and vitamin K antagonists, you can see it inhibits factors 2, 7, 9, and 10. And then later we'll be talking about some of these factor 10A inhibitors and dabigatran, which is a thrombin inhibitor right here. So what are PCCs? These are prothrombin complex concentrates. And this table is taken from the guidelines for reversal of antithrombotics that was published in Neurocritical Care in 2016. And it just kind of breaks down some of the 3-factor products and 4-factor products and what is in each of them. And the 4-factor products, you can see they have more of the factor 7 compared to 3-factor products. And when we're talking about activated 4-factor PCC, the reason why it's activated is that the factor 7 is in its active form. So when we look at these and go back to the clotting cascade, you can see right here, these are all the factors that are in the PCCs, which is why they're useful in the reversal of warfarin, factor 10A inhibitors, and there's some data in the thrombin inhibitors, although very limited. So just when we're looking at FFP versus PCCs in warfarin, Dr. Vadix kind of went over this earlier in